Today we are here to officially kick off the new space for the Treatment on Demand Services, a new program offered by Denver Health in partnership with the Department of Public Health and Environment. I want to thank everyone here today. We have therapists. We also have Dr. Simpson, who is really going to be in charge of this effort here at Denver Health. We thank you as well. I want to tell you how excited the city of Denver is for this effort. We all know that today across this nation we are facing probably one of the most serious drug epidemics since the late 60s and the early 70s. And so why we arrive at this challenge, an opportunity around demand, because we've learned firsthand those affected by opiate addiction or misuse want support, but face barriers to accessing the treatment that would help them. And Veronica, we want to thank you for sharing your story with us as we took the tour today. This program simplifies that access with the idea that there is no wrong door to treatment. And the approach, a human approach, will be that what changes lives. This is the first medically assisted opiate treatment program of its kind. And with the services on demand, with same-day treatment, patients who are ready to make a change in their lives, this is critical, and a change in their behavior, if clinically ready and appropriate, can immediately enroll in ongoing treatment. Since it started in December, we've already seen incredible increase in next-day visits. And we also, I understand your switchboard is lighting up with people who are asking for support and help. So that's a wonderful sign. It's no surprise that this program is both necessary and vital to ensuring the public health of our residents who, like many across the country, are suffering from substance use issues as a result of the opiate epidemic. And delays in treatment can jeopardize their chances of successful recovery. As we learned from Veronica, it's very important we get on it, and we have intensive services ready for the individual who's ready for treatment and support. Treatment on demand is a vital step toward addressing the public health crisis of the opiate misuse here in our city. Every step forward we take in addressing this crisis can save a life. With me today, of course, is Bob McDonnell, our Executive Director over at Public Health and Environment, and the Public Health Administrator for the City of Denver. DDPHE, like Denver Health, is committed to working with the community partners to address this opiate crisis. That's why we brought together a team of leaders from across the government agencies and community organizations to develop a plan to combat this opiate crisis here in our city. Now that's Denver's opiate response strategic plan that has been released recently, that we are putting into action and following up on the words that we've said are important for us to meet this crisis head on. By offering treatment on demand to these struggling with opiate use, we are moving forward toward achieving the goals we set forward in that strategic plan. We just finished an incredible tour of the emergency department where we got to meet therapists who are here in the crowd, staff, as well as the courageous Veronica. They will be assisting patients and helping them move to a continued treatment. This is critical. Now I'm going to hand it over to Bob McDonnell here to my left, who will talk a little bit more about our city and county's efforts and DDPHE's efforts and moving forward with this effort.
Great, thank you, Mayor. Thank you, Mayor, and I want to thank our partners at Denver Health and Hospital Authority and CEO Dr. Robin Wittenstein for the opportunity to say a few things. The Mayor mentioned, and it's worth mentioning again, that Denver's not alone in struggling with the opioid epidemic. We're seeing across the country cities struggling with increased visits to emergency rooms, increased visits with hospitalization and extended stays, and unfortunately, in some cases, an increase in fatal overdoses. It's impacted individuals of every race, every creed, every color. It's impacted their families, their friends, and society as a whole, our communities here in Denver. But together, as we partner with Denver Health and Hospital Authority and many other great organizations, we're going to overcome this. We're going to correct this. Under the charge of and the leadership of Mayor Hancock, the Department of Public Health and Environment conducted a needs assessment where we reached out to those in our community that are struggling with opioid misuse, asking them what their needs are, asking them what they see as the barriers to treatment, asking them what their perspectives are. And with that knowledge, we we convened a group of over 100 organizations, people that were subject matter experts in behavioral health, people who were subject matter experts in mental health, in substance misuse and public health, law enforcement agencies, and the community at large to put together Denver's substance misuse and opioid misuse strategic plan. And we have launched this effort here at DHHA as a huge piece of that program. Our plan, Denver's substance misuse strategic plan, recognizes that we've got to be ready to go when people reach out for help. That opportunity, that window of opportunity is sometimes very, very narrow. And we have to be able to respond as a city with our partners at Denver Health to provide those services when people are ready to receive them. I'm proud, I will tell you, to be standing here today with our partners at Denver Health to launch this program. I'm proud to partner, and I thank the staff here at Denver Health, where honestly medical services are unparalleled. So thank you for your efforts. We appreciate your partnership with the Department of Public Health and Environment. We appreciate your partnership with the city. And with that, I'd like to turn it over to Dr. Robin Wittenstein, the CEO of Denver Health. Thank you.
So every day I get to come to this organization and look at the work that we do. And I can tell you that today I'm prouder than ever before. So first I want to thank Mayor Hancock for his vision and his willingness to tackle a problem that has caused such terrible damage to our society and to the people who live here. And to Bob McDonnell for being such a good partner with Denver Health. We see people who come into the emergency room who are dealing with addiction, with medical problems, with social issues that many of us find hard to imagine. But there is a point in time when somebody says enough. This treatment on demand program is the response when somebody is ready to say, I want my life to be different than it has been. I want help and I want to stand forward. And I am incredibly proud that we have people here at Denver Health who are standing there, putting their hands out and saying, you are not alone. We are here to help you today in the treatment and demand program. We will get you into care today. We've already had 77 people who have received same-day induction services. We have 56 people who have shown up the next day for treatment. Those are people who are entering a new phase in their life where they are going to be able to get the medical care they need, they're going to get education, they're going to learn how to deal with their addiction and manage it for the rest of their lives, and they're entering into recovery. This program is part of a larger effort on the part of Denver Health and the city. We've established a Center for Addiction Medicine, and the goal of that is to not only provide help in that moment in time, but help for the rest of a person's life. Whether they need induction in the emergency room, they need a bed in the hospital, or they need care and help in the outpatient setting, we will be there to help the people of this city. And most importantly, we're going to look at partners like the city, like the public health department, but others in the community to say, when somebody's ready, when they need help right now, they need help with medical care, they need help with education, they need help with housing, they need help with a lot of things, and we are going to come together as a city, as a community, who cares about every single person who lives here, and we're going to provide that help. Once you become part of Denver Health, you're part of our family forever. So we're not going to give up on the people who come in. When they're ready for help, we're going to be ready to help them. So I want to say thank you. Thank you to the people in the emergency department, in our behavioral health division, in our public health division, everybody in the organization who reaches out and just says, tell me when, and we'll be there, because it's an incredible program. So thank you very much, and thank you, Mayor, for your help. Thank you.
Talk a little bit about the financial commitment here. How much is the city putting forth? How much will this cost? And also, how many people do you expect to serve?
Well, I think it's important to note that the city supplemented the great work and the resources that were in existence here at Denver Health. So to kick off this pilot program under the mayor's direction, we allocated an additional roughly $500,000 to support the great work being done here. That's in addition to, of course, other resources that the hospital has. And we'll continue to evaluate where additional resources are needed as we evaluate this program.
So that'd be $500,000 annually?
To start I think that is something that's evaluated on an ongoing basis, but we recognize the importance and the need for ongoing resources to continue to support this program. We'll have to make that evaluation as we go in terms of what additional amount is needed to continue the great work here.
And then in terms of the number of people you think you might be able to serve?
Do you want to take them?
So the only right answer to that is all of them. So it's anybody in our community who struggles with addiction. You know, I'm not sure how many people we serve right now, although it is large numbers, and we've certainly got people here who can get that information to you. But the truth is, when you think about health care and healthcare costs and the challenge that we've got, getting people into effective treatment and helping to avoid a cascading effect of visits to emergency room, hospitalizations, the investment that the city's making, the investment that Denver Health makes, is an investment not only in that individual, but in the quality of life for everybody who lives here, and in avoiding costs that we just don't need to spend. So there are going to be thousands of people who are going to be coming through this program and into the Center for Addiction Medicine, and they will remain with us for years to come.
And then how would it work? So if someone comes in and they're in the ER and they have an opioid addiction, they would be able to say, okay, I need help. And they would instantly go over to the center? Is that
So we could do an immediate induction, which gets them put them into an outpatient treatment program. So they'll be coming every day to the outpatient program from that point forward to get their daily dose of medication for the medication-assisted treatment program. In addition, though, we'll also put them into other services that are going to be helpful. So if they need behavioral health counseling, if they need help with housing and other things, we'll have programs that wrap around that. That's the point of the Center for Addiction Medicine. Addiction is a complex disease, and trying to resolve it takes not only significant time, but it takes a lot of different disciplines coming together, and not just medical disciplines. This is a disease that is both medical and social in nature, and so we're pulling together groups of people who can address the entire spectrum.
Thank you.
Thanks.
Good job. Good job.